Hello, my name is Taylor Penland, and I am in my 4th semester of the ASN program at Southwest Baptist University. My final literary project is over pediatric compliance with the influenza vaccine. Vaccine compliance is something that I am very passionate about. As a mother and soon-to-be neonatal pediatric nurse, it is important to raise awareness and research this topic to uncover why compliance is so low and identify solutions to this issue. The compliance of the annual influenza vaccine is something that affects the United States each year. From 2010 to 2014, there were 358 confirmed pediatric deaths related to the influenza virus. The influenza virus is a major infection risk for children across the United States and can largely be prevented by receiving the annual influenza vaccine. As a healthcare system, it is important to increase annual compliance for the influenza vaccine to prevent community spread of the influenza virus and to keep the influenza infections low to minimize the pediatric deaths related to influenza. In a 2000 study, it was shown that there is an 80% reduction in children vaccinated for influenza becoming ill with respiratory type illnesses, rather than the children that were not vaccinated. My PICOT statement is that in pediatric patients, how does compliance of the annual influenza vaccine compared to the lack of compliance affect the overall influenza rates within the duration of the annual influenza season? For my research, I used Medline. After accessing Medline, I searched the following: influenza vaccine and compliance or adherence and child or pediatric or children. This gave me 1,616 results. I then used the following limiters: date of publication between 2000 and 2018, and age, all children 0 to 18. While setting my original Medline search selections, I made sure to relate the search criteria directly to my PICOT statement to limit any excess or unnecessary articles. The rationale for this selection of these articles is that I wanted to have a fairly recent research to maintain reliability. I also wanted to ensure that research pertains to only children. Similarities of my research findings include that a majority of the studies were all completed in pediatric clinics. For example, BMC's 2013 study of in-office vaccination compliance factors demonstrated the use of national pediatric clinic participation. The same applies to the study of overall vaccine compliance. This study shows that a majority of vaccines were given via pediatric office visits. The inconsistencies of the research show that there are several different methods of collection. For example, in BMC's 2013 study of factors that affect influenza vaccine compliance, data was collected via surveys or questionnaires during pediatric office visits, although Flannery's 2000 study of research on pediatric deaths related to influenza was collected via local health departments. A few gaps that I found throughout this research include the emphasis on vaccine compliance in relation to profits on the healthcare system's end. Another gap that I found was the issue of healthcare providers not promoting the need for the amount of education and willingness to give the vaccine. In Edwards' 2011 study of pediatricians' attitudes towards influenza vaccines, it is shown that less than 24% of the pediatricians interviewed favored vaccinating average school-aged children. This is a major gap and needs further research to uncover the underlying reasoning behind this bias. In the BMC 2013 study, the limitation was the ability to reach out to participants due to the number of participating pediatric offices. This shortened the subject pool significantly due to the amount of pediatric offices that opted out to participate. In the Hurwitz study on the daycare-aged children, it does show a decrease in overall infection rates of the children that have received the influenza vaccine, but unfortunately it is limited to preschool children that are attending a daycare. In conclusion, I do not feel as if there is enough research to support a practice change for increasing compliance of the influenza vaccine in pediatric patients. I believe that more research is necessary to ultimately lead to an increase in overall compliance.